Right now, we're jumping into a topic that is just so common, completely natural, but honestly, it's pretty misunderstood. We're talking about the aging prostate. Now, this gland starts out about the size of a little walnut, but it can end up causing jumbo-sized problems for a lot of guys. If you, or maybe a loved one, are noticing some weird changes in urinary habits, you might be feeling a bit anxious, right? The medical jargon doesn't help either. But hey, take a deep breath. We're going to break it all down step by step today and give you the exact knowledge you need to understand what's actually happening in the body.
And to kick things off, check out this number because it completely normalizes the whole thing. 80%. Seriously, the prevalence of an enlarged prostate spikes remarkably as we get older. Nearly 80% of all men will develop this in their lifetime. And get this, by the time men reach their 80s, over 80% of them have it. So if you're dealing with this right now, you are literally in the majority. It's just a standard part of the male aging process. Okay, so to make this super clear, we've laid out a roadmap for today. We've got 5 parts. 1, the prostate explained. 2, why does it grow? 3, the bottleneck effect. 4, getting a diagnosis. And finally, 5, navigating treatment options.
Let's jump right into section 1, the prostate explained. All right, before we can really grasp the problem, we've got to look at the normal anatomy. The prostate is a male gland sitting deep in the pelvis, right below the bladder. And the absolute best way to picture how it sits in the urinary tract, think of a donut. The prostate is the actual donut, and it completely wraps around the urethra, which is essentially the main pipe carrying urine out of the bladder. So it surrounds it, just like a donut surrounds its hole. Now, its day-to-day job is to secrete fluids, including enzymes like PSA for semen. But as you can probably guess, its location right on that pipe is exactly what makes it such a big deal when we start talking about urinary symptoms. Now, the prostate isn't just one solid, uniform block of tissue. It actually has these distinct structural zones. Take a look at the green area here. That's called the transition zone, and it's the part immediately hugging that central pipe, the urethra. In young guys, this zone is only about 10% of the gland, but it is the exact spot where benign prostatic hyperplasia, or BPH, pops up as men age. This is absolutely crucial to understand, because unlike BPH, prostate cancer usually develops out in the peripheral zone, which is the outer area marked in red or blue here. 2 totally different zones, 2 very different conditions. Moving on to section 2. Why does it grow on? So you're probably wondering, why on earth does this specific transition zone just start expanding as we get older? Well, it's definitely not random. Right around age 40, the prostate gland starts growing by an average of about 2.4 cubic centimeters every single year. It's a steady, relentless march, and it's heavily fueled by hormones. Androgens, specifically a really potent growth factor called DHT, are major players here. Over time, the prostate actually becomes more sensitive to these hormones. Plus, estrogens like estradiol act as kind of a spark plug, stimulating even more growth. Combine those hormones with some abnormal stem cell behavior, basically stem cells hanging around way longer than they're supposed to, and throw in some genetic susceptibility, and boom, you've got a recipe for that tissue to physically expand. Which brings us to section 3, the bottleneck effect. Now that we know the why, let's talk about the mechanical fallout. First off, let's clear up some of this medical alphabet soup. You're going to hear the term BPH a lot. Benign prostatic hyperplasia literally just means the physical, non-cancerous growth of the tissue right there in that transition zone we just talked about. It's simply the medical label for a physically enlarged gland. That's it. But here's the kicker. Just having a bigger prostate doesn't automatically mean you have a problem. That is where BPS, or benign prostatic syndrome, enters the chat. BPS is the actual set of lower urinary tract symptoms. You know, the frustrating midnight bathroom runs, the weak stream. It's what a guy physically experiences because of that underlying BPH growth. And then we have BOO, bladder outlet obstruction. This is when that enlarged prostate actually acts like a physical roadblock for your outflow pipe. This is a clinical diagnosis, meaning doctors use specific urodynamic testing to prove, yep, the flow of urine is genuinely being blocked by this enlarged gland. So let's look at how this whole domino effect plays out. Step 1, the transition zone tissue undergoes that hormone-fueled growth. Step 2, because it's wrapped right around the urethra, all that firm new tissue starts squeezing inward, essentially compressing the pipe like you're stepping on a garden hose. Step 3, that squeeze leads straight to the bladder outlet obstruction. And finally, step 4, because the exit is blocked, the bladder muscle itself, the detrusor, is forced to completely change how it operates just to push urine past that bottleneck. It helps to think of the bladder as a muscular pump. When it's constantly straining against a bottleneck, bad things happen. At first, the bladder muscle goes into absolute overdrive. This overactivity triggers those really annoying irritative symptoms, like suddenly feeling like you have to go right this second. But over time, fighting that resistance tires the bladder out. The wall can weaken, meaning it doesn't empty all the way. That leaves stagnant urine behind, which is practically an open invitation for UTIs and bladder stones. And even worse, all that strain can cause the bladder muscle to drastically thicken, structurally changing the bladder itself. So a problem down in the prostate ends up impacting the entire system above it. All right, section 4, getting a diagnosis. So how do we catch this and intervene before those permanent structural changes happen? Well, when someone shows up with these urinary symptoms, doctors have a very specific toolkit. And their main goal, make absolutely sure they aren't treating the prostate if the real culprit is something else, like a UTI or a nerve issue. They start with a deep dive into the medical history and a physical exam. And yes, that includes a digital rectal exam, or DRE, so they can physically feel the prostate's size and shape. They'll run a urinalysis, and they'll probably ask for a voiding diary to track your bathroom habits. But a real game changer here is the IPSS symptom score. It's a standardized questionnaire that puts a hard number on exactly how severe your daily symptoms are. If they suspect a serious blockage, they might even use ultrasound to check for leftover urine in the bladder, or a uroflowmetry test to measure how fast your stream actually is.
Finally, Section 5, navigating treatment options.
Okay, so the doctor has all this data. Now what? Well, take a look at how this entire decision tree hinges on that IPSS symptom score, right in the middle. Your treatment path is totally dictated by how bad your symptoms are. If you score in the mild range, say between 0 and 7, the standard move is just watchful waiting. Basically, hey, we know it's enlarged, but since it's not bothering you, we're not going to poke the bear just yet. But if your score jumps into the moderate to severe range, from 8 to 35, that triggers action. We're talking medical therapies like alpha blockers to relax the muscle or inhibitors to actually shrink the gland. And if the symptoms are causing major complications like kidney damage or you literally can't pee, then you're looking at surgical options to physically clear out that bottleneck. Understanding how our anatomy changes as we age is absolutely the first step in taking charge of our health. But it really makes you wonder, doesn't it? With how fast medical science is moving, will we eventually figure out a way to just flip a switch and turn off this hormonal growth entirely? Imagine making the aging prostate a thing of the past. Knowledge really is power for the aging body. Listen, thank you so much for joining me today and diving into this explainer with us. If you found this breakdown helpful and you enjoyed all the graphics we walked through today, please hit that subscribe button for the Medicine channel. We've got so many more clear, concise explainers coming your way. Until next time, stay curious and stay healthy.